But from an evolutionary point of view, these things exist for a reason, otherwise evolution would have weeded them out. Probably a better and deeper question is, why do we have ADHD? Like, what is it for?
But if you've got that hyper-focus and you channel it into the wrong things, how can you head that off? I think schools is crucial.
We are not as ordered disorder. So although the word has that negative connotation, when you break it down as you've just done, descriptively, it has a place if you understand it in that way.
One very interesting theory is that it may have helped us to be better hunters or to focus more on threats. We should be happy that we've got people with ADHD in our society because they're good at some jobs that the rest of us aren't.
How do you put that into the education process where people can recognise it?
You're introducing into the lexicon of understanding neurodiversity, a whole new way of looking at how we can possibly break that cycle, but also how we can understand that cycle.
It's not a bug, it's a feature of the richness of human existence, otherwise we would all be like drones.
Your difference is a challenge, but it's a challenge you should embrace and be proud of. But embrace the whole damn thing, but don't feel shame.
Dr. Dan Nicolau, welcome to ADHD Beyond the Label.
Thank you for having me. I'm happy to be here.
Thank you. Tell us a little bit about yourself before we start.
Not that much to say. So I'm Dan. I trained as an engineer originally, and later I did a PhD in computer science, what now might be called AI, and later I became a medical doctor, and now I'm an academic physician.
Professor, doctor, 10 times over.
About 10 times.
Many of the conversations we've had and got to know you over the last sort of year and a half have been about inflammation. Big interest to us and kind of relevance to everything ADHD is how that ultimately correlates. I'd love to hear that from your point of view and open that up as a conversation.
Yeah, sure. Okay, so thanks. Great question. We don't really understand this component of the, what happens with ADHD very well, but there's obviously a connection. Many studies have found a connection between inflammation levels and ADHD, both before you're born, so your mom has inflammation, and the kids who are born to moms who have maternal inflammation when they're pregnant are much more likely to go on to have ADHD. And then patients with ADHD have higher levels of inflammation, which is associated with not just, as we were talking before, not just with mental health, like above the neck, but for example, they perceive pain differently. They're much more likely to have chronic pain and to perceive pain worse, have sleep problems and other things also associated with inflammation. And then finally, I suppose, that pushes us towards thinking about whether, if that is true and inflammation is a driver of ADHD, then the medications that we use for ADHD should work at least partially by reducing inflammation. And indeed, that is what we find. Those medications seem to work at least partially, not by directly acting on the brain processes, but by bringing down inflammation in the blood.
That's interesting because Dan's our first guest that I believe doesn't have ADHD.
I don't have ADHD.
It must be intriguing to you, and I'm interested to know what you would like to get out of the conversation talking with Dan from your perspective.
Yeah, it's fascinating, and you've got such a great way of understanding science from a different perspective. When I look back in prepping myself for today, your take on cancer being something not to fight, cancer being something to find a way of tolerating and improving so we can live with it, because we're always going to have it. Mental health is exactly the same. We have mental health. It's like cholesterol. There's good cholesterol and bad cholesterol. We have to have mental health. So if there's an element of our mental health, let's say ADHD, where we're not in kilter, we're not in the right space, we're not born with an equilibrium that we want. What's Dan's take on what we can understand that to be, and how would you come at it from that? It's the mafia being cancer. I want to work with you to find out what's the Dan perspective on what ADHD is, because it's here, it's real, it's something that a lot of people have, but it's still to this day not explained well enough, I think, for people to grasp. And you're my opportunity. No pressure.
No. Thanks for that. It's a huge amount of pressure. We've always thought about these things as being bad. Depression, anxiety, ADHD, they're invariably thought of as being bad.
Disorder. at the end of ADHD. I mean, it's like it's not a positive association.
That's right. It's very interesting you use the word. It's a disorder or a dis-ease. A disease is your body is not at ease. But from an evolutionary point of view, these things exist for a reason. Otherwise, evolution would have weeded them out. So probably a better and deeper question is, why do we have ADHD? Like, what is it for? Otherwise, it wouldn't have survived in the population. So we don't know, but one very interesting theory is that it may have helped us to be better hunters or to focus more on threats at the exclusion of other things. So here's a berry that may be really tasty and nutritious or may be poisonous, or a mushroom. That people who had our ancestors who had an ADHD type predisposition would have been better at some of those tasks within a tribe, leaving other members of the tribe to do things that didn't require that skill set. So instead of thinking of it as a disease, I think we should think of it as potentially a gift. And indeed, autism and spectrum, ASD, are of that type. As you mentioned before, many people on the spectrum make fantastic doctors, because you can focus on things at the exclusion of other things. So I don't think ADHD should be thought of as a disease. It's just...
You've already opened up something that's quite remarkable. You said you talked about disease. It's a dis-ease, your body not being ease. I'm 61 and I'd never thought of disease in that way before. And then you took that to disorder. And immediately sat here thinking, yes, we are not as ordered. We are not as organized. Disorder. So although the word has that negative connotation, when you break it down as you've just done, descriptively, it has a place if you understand it in that way. And all of us, we talk about removing the shame of being neurodiverse. There should be no shame. And automatically I'm picking that up from you. And I think we're men on a mission to remove the shame of ADHD and to change the narrative. And you're already, just by breaking down one single word, of all the words you could have chosen in the English language, you chose that one to break down, which has just blown my mind straight away. So, but what about that whole shame piece of being different?
I think I'm not an evolutionary biologist, but if you had one in here, they would probably say we should be happy that we've got people with ADHD in our society because they're good at some jobs that the rest of us aren't.
Embrace it.
Absolutely. They should get medals, and people with anxiety are better at picking up on threats. So of course we need that within the population, and people with depression are better at maybe processing some difficult feelings that others push away. So all of those things without those things, humanity wouldn't be as it is. So it's a shame it really is a shame that we think of it as a disease or a disorder. It's not a bug, it's a feature of like the richness of human existence. Otherwise we would all be like drones, So I just don't think, part of the reason I laughed when you asked me if I had ADHD is because I just don't think of it as a disease. It's something to manage, but it's a feature of people's lives.
Yeah, I like that. I like the way you dealt with that. And I think, following on from what Phil was saying, that psychological element, that naming of shame, if you like, relating to a big part of what you focus on research, and again, bringing up inflammation. How can that ultimately affect someone managing ADHD? So there's the whole labeling. Someone finds out they've got ADHD, particularly as a youngster, that can send them into a downward spiral. I'm not normal anymore. Despite what the parents might be saying, what the doctor might say, there's a lack of, dare I say, education out there where that child then can feel normal again. What is that actually doing from an inflammatory point of view to people, and how can that be countered, I guess?
Yeah, we don't understand it very well. Certainly feeling there's something called social defeat, basically where you're told, sometimes these are studies done in people, other times they're in animals, but where you're made to feel that you aren't good enough or
that goes back to being part of a tribe, right? We all wanted to get
communities,
on. So the moment someone feels a bit eliminated, they're not feeling like they're contributing or they're an outcast.
That's right, and that drives that there's a lot of evidence now that drives low-grade inflammation for long periods of time, which accelerates aging, which gives you diabetes, heart disease, other mental health problems. So inflammation to some extent seems to be the sort of the currency of feeling unwell, both physically and mentally. So and therefore I think people think these are new ideas about the mind and the body being connected, but the Romans had, Lucretius, the poet, had something about mens sana in corpore sano, a healthy mind and a healthy body. So these are not really new ideas, and they're not Western either. The Chinese, Eastern cultures had them too, the South Americans had them too. So we're sort of rediscovering what the ancients knew all along, which is you can't have a healthy mind without having a healthy body, and vice versa as well. But inflammation is maybe what we know now, and we're discovering more about that they could not have known about. I think the ideas have been around for...
So when you talk inflammation, help me out a little bit here. What is inflammation? That may sound like a really stupid question.
No, it's not a stupid question.
To structure where the understanding is between a healthy mind and a healthy body, and the effect of an unhealthy mind for a moment causing inflammation. What is inflammation?
Yeah, because it's actually a physical thing, isn't it? So
Yeah.
the mental thoughts create something. What is it?
So what is it?
Inflammation is a very active area of research with thousands of very clever people working in it. So we don't completely understand it, and it's changing our view of disease, of life, of aging. But briefly, when you're subjected to some sort of injury, like a cut or an infection, your immune system, whose job is to protect you, keep you alive, will mount a response to try to either heal the damaged tissue, in the case of, say, a cut, or if you have an infection, to try to clear the virus or the bacterium. So to do that, it mounts a response which does the job, but also causes some damage. As usual, when you repair something, you have to do a little bit of damage to it. And that is the process of inflammation. If that's happening acutely, as in on a short time scale, so you have an infection, you feel rubbish, the immune system comes, white blood cells, cytokines, and they sort it out between inverted commas, and then it goes back down to a normal quiescent state, to a non-inflammatory state. That's what's meant to happen. But if you have a persisting injury that's not really going away, such a social defeat, not necessarily a physical one, it can be a psychological thing, or you don't have a persistent insult, but the inflammatory system has decided in some sense that you need to keep repairing, even though there's nothing to repair. It would just carry on sort of damaging the tissue locally, even though there's nothing really to repair. And these processes happen, for example, in rheumatoid arthritis, but also loads of other COPD, which is a lung condition, and heart disease is an inflammatory process, cancer is certainly an inflammatory process, mental health conditions are, to some extent at least, inflammatory processes. So it's a defect of, it won't switch off basically, it will just carry on trying to deal with the problem, but there is no problem to deal with. But it continues to damage in the process of, sort of like an army that won't stand down, or like riot police that just won't go home. Like there's no more riot, you can go home, but they'll just keep on arresting people and kicking down doors. There's no more.
Is that a vicious circle though? I'm thinking of how your brain works with this as well, where the cycle, the emotional thoughts and the ADHD symptoms that are so common are actually perfectly aligned to then create really quite nasty, negative physical effects with the body that actually probably doesn't help the whole thing. So you're in a cycle of, am I right in saying that? Because that doesn't sound...
Absolutely. And if you've gone, and I put this to you for either denial or confirmation really, but if you don't understand yourself and you don't understand why you're not achieving what you believe is your potential, and you are not able to complete the tasks that other people can in a way that society's norms would want you to, you're going to start to get that inner chimp talking at you and producing that inflammatory response.
You're going to create bad habits,
and you can create
bad actions, right?
Absolutely, bad habits, bad actions, which we talk about. Once we've got someone in treatment and we've got somebody stabilised and optimised on medication, we then got to undo all that damage and learn how to not have an inflamed life, perhaps, is a way of putting it. And when we talk about removing the shame of that difference and the disorder and bringing back order, I can see now, talking to you, how feeling shame could bring about even more inflammation and that inner army, those riot police fighting within you, and the conflict that brings. Is that making sense? There's kind of, you said there's no riot to police, so stop policing it. I was a policeman and I've policed riots. believe me, once they finished, I wanted to go home. But
I bet.
If you can't stop the riot police or you can't stop the army fighting, you're going to have a continual problem. So mental well-being really starts to actually take on a physiological approach there, doesn't it, at that point?
I was smiling. Yeah, that makes perfect sense. I was smiling because I started writing a book about inflammation. I didn't have a title. You just gave me one, An Inflamed Life. It's come to a bookstore near you. Thank you for that.
Quote me.
I will. So I guess I would throw the question back to you about how you feel physically. If everyone has felt shame at some point in their lives, most of us feel it fairly routinely. How does that make you feel? I mean, in periods in my life when I felt like I wasn't doing well enough in exams or other personal things, I can almost feel myself being tender. I'll do this and my knuckles a bit like kind of hurty. And what you are actually describing is inflammation, that feeling that of being unwell. What you're actually describing is inflammation. But I guess I will throw the question back to you both. When you feel like you're not achieving your full potential, I think is what you said. Don't you feel a bit like tender?
It's the habits though as well. It's like, absolutely. So you may not eat as well. So absolutely. If I'm not feeling good, if I'm reflecting and feeling shamed or not good, then I might not eat as well because my whole viewpoint's dropping. I might stay awake too late rather than prioritizing going to bed. So my whole way of living isn't as healthy. And that's actually then going to create more physical damage, which, as we know, doesn't help.
You're introducing into the lexicon of understanding neurodiversity a whole new way of looking at how we can possibly break that cycle, but also how we can understand that cycle. Comfort eating. Yeah. We feel down, we feel flat.
Drinking.
I'm going to have
smoking.
Alcohol, smoking.
Just about to say, then there's the escapism.
Absolutely. Then you get into the things that you shouldn't be doing, but you're doing them because you want to. We off-piste, but we were treating a lady who turned to prostitution to cheer herself up. And that's the most bizarre concept in life, isn't it? To actually go and work the streets, to cheer yourself up, to feel better about yourself. And yet once we treated her ADHD, she didn't have that need anymore. The whole construct of what we're talking about here is phenomenal, isn't it?
Well, you've seen it from and that's also illegal. So how much illegal behaviour is now happening and has been happening for however long, where people are not fitting in and they're trying to escape for getting drunk and then they're committing actions they wouldn't do if they understood themselves better. So a question to both of you, how do you head that off early and how do you put that into the education process where people can recognise it from a kind of overarching mission with what you're doing and also from more of a scientific point of view?
You're both looking at me.
That's because it's your turn to talk.
I think educationally, if we take education out of school, if we take educational into life education, if we actually understand that being different is good, and I really will play back your words at the start of this, that to be the hunter-gatherer, to be the person that's going to be slightly different, to test why do we have anxious people, why do we have people who feel a bit depressed, what they bring to the party. And if we can get kids at the age of 8 to actually understand your difference is a challenge, but it's a challenge you should embrace and be proud of, without saying you don't need treatment, you don't need help, you don't need whatever, but embrace the whole damn thing, but don't feel shame. That's where I think we can start a journey. We've got patients who are presenting at the age of 80, and the moment we tell them that there's a reason why you have felt different, we turn a light on. And I think we start to reduce inflammation at that point, and that becomes a bit of a goal. And then you tap into all of the things that you can do differently. I think there's something in this about communication.
That's a really interesting perspective. I guess we don't usually think that way. In science, we try to think about the technical aspect. That's very
you see it once it's happened, heading it off early. So you're dealing with the inflammation as you've got it. So it's how do you head it off to stop it from even developing?
Well, one way to think, it's a very good question, and no one knows the answer. But one way to think about it, and we have only recently begun to think this way, is that the brain and the immune system are not, they work together, they're not distinct. They've always been studied distinctly, like immunologists are, like I'm in a school of immunology, and then people in neuro. But the brain and the immune system co-evolved together to protect you. And when you ask people, I'm not going to give you the test, but I can tell you that when I ask audiences, almost everyone says that the immune system is older. If you ask people which is older, the brain or the immune system somehow feels more primeval. Actually, the brain is much older, hundreds of millions of years older. So in most respects. So the brain is sort of trying to control the tendencies of the immune system to over-respond. And in turn, the immune system is also doing things like, for example, if you have a virus, the inflammatory response will tell your brain to like go to bed, have soup, and call your mom, which only the brain can do. So they talk to each other a lot. And consequently, when they don't talk very well, when they don't communicate very well, or worse, they're having a fight. I mean, they're like a very old couple. And when they have a bad argument, the results are inflammatory disease and mental health issues as well. So one way to think about it is how to break the cycle of miscommunication between them, how to get them sort of like a bit more in sync, kind of like couples therapy, you know, for the brain and the immune
Couples therapy between, you see, you told me that this man would bring it down to a level of
relatability. He could have used all sorts of jargon
absolutely.
Then and confuse the hell out of anyone watching and listening and us, but he breaks it down.
Couples therapy between the brain and the immune system. And that goes back to, I think, looping it all the way back from me, is helping that person understand there should be no shame in needing couples therapy. There should be no shame in trying to fix something that's got a struggle on the go and actually attack it and go for it.
And the relating this to ADHD and that sort of hyper-focus, if there's a misalignment, an argument there, if I'm right in saying this, that by default the behaviour will be an overreaction potentially, that other people might not. That overreaction will then potentially send the immune system into overdrive to overprotect, which could massively overstimulate a physical response that creates inflammation that then only makes it worse, right? It could be gut, it could be all sorts of physical. Am I right in saying that? Because the ADHD side thing is a hyper-focus. It's going to be, panic, which is going to send that inflammation wild.
Yeah, that's right. In fact, the gut is a great place to start because, again, I'm not going to test you, but usually when you ask people what percentage of the immune system's in your gut, they'll say like 10% or something. It's actually more like 75%, which tells you a lot about how important what's happening in the gut is in terms of protecting you and immune response. One way to think about it, and maybe this is obviously highly speculative, but some of the reasons that we think things like ADHD are problematic are to do with the environment we inhabit, which is very unnatural. Like ADHD is sort of a problem because maybe on a test in school, you can't concentrate on the multiple choice questions as well as someone else. But that's a very artificial environment. If you have ADHD 10,000 years ago, you were the best hunter in the tribe. You're like the Brad Pitt of the tribe. So people would have thought someone concentrating for long periods of time had a problem and was a lot more likely to get eaten by wolves or something. So some of it is, the entire thing is conditional on this strange environment that we inhabit with like microphones and phones and streets and cars and stuff. Whereas in fact, if you just remove those people and put them somewhere else, the ADHD patients would all of a sudden be like superheroes and everyone else would look like duds in a relative sense, you know?
Listen, it's about finding a part of that. I want to come back to something else you said, but part of that's about finding what your raison d'etre, where you're comfortable. Was the square peg in the square hole? And that might not be in the classically defined environment out there. It might be in redefining it for yourself and what have you. But when you talked about the gut and 75% of the immune system coming from the gut, of course, if we've got a cycle in human behaviour for someone, I'm again going to use the ADHD example, where we feel flat, we can't organise ourselves, we are disordered in our ways of planning a diet, shopping for that diet, cooking food for that diet. We then resort to food that's suboptimal in terms of gut health. Therefore, our immune system isn't going to be working as well. So our couples relationship chances are reduced from the get-go, which then produces up here more problems, which produces more need for couples therapy, yet we've still got the bad diet. That cycle, it has got to be broken, hasn't it? And it brings me back to, I think in my mind, yes, medicine, of course, I'm in a medical business, that plays a part, but all that's doing is short-term putting it at bay, putting it at bay, putting it at bay. We're never going to not need that. But if we have mental well-being, if we actually have gut well-being, and we correlate those two, ADHD below the neck as well as ADHD above the neck, we can start to get the couples therapy and give it a chance, to use your expression. And you said, you know, what could you do? I think this is where we stumble on difference of approach, isn't it? Is to actually look at the joy of life and actually start to do something about that, as opposed to the pitfalls of having a disorder.
I love your thing about ADHD below the neck. I'm going to borrow that. That's okay. I'll give it back later. Yes, I'm starting to be in your debt.
I doubt it.
Yeah. In terms of, very briefly, in terms of thinking about the brain and the immune system as systems of control, in the sense of like how an airplane might control its pitch and a roll, or like how a crane might control itself in the face of wind. One way to think, at like a high level, about how to improve things is to think about what's driving the miscommunication. Like, is it just a mistiming thing? So you feel a bit rubbish in your head, as it were, and then you go and eat a tub of ice cream or drink too much or something, and then the next morning you're inflamed or hungover, or you have a tummy upset or something, and then that makes you feel, you know, everybody who's had too much to drink knows you don't feel good in your head the next day either. It's not just, and so that will then make you not exercise, like not go to the gym, which you're planning to do. To some extent, that's just a mistiming issue, right? At least partially. You do something which causes a downstream effect, which then leads to the cycle. Whereas if you just get them in sync a little bit, go to bed a bit earlier. So I don't think we're supposed to go to bed when like the sun goes down. I don't do that either. I'm a night owl, but my aim for next year is to try to get to bed a bit earlier. But if we could just get the timing a little bit better, I think that happens with couples too. Sometimes the fighting is just because they're a bit out of sync, like someone's working a night shift or someone, you know, whatever, has been at home having to like look after the kids, and a lot of the fighting is, if they just had like more in sync routines, then a lot of that would go away. And I think that's probably true of the immune system.
I was just going to say, link that back into the immune system, into gut health, into brain health, and just link it. So if we synchronize above the neck and below the neck a bit more, we stand a greater chance of coping with something that is different. So we start to actually play on the mindset of this. We've got a physiological difference. We're going to have to deal with that. That's a medical phenomenon that we can deal with. But if we can deal with emotions differently to improve overall well-being of how we feel about being different by synchronizing above and below the neck, we could be actually making life a lot easier for people. And surely that's the goal, isn't it?
That's where I'm looking in on. Like, you guys have got your own perspectives. My whole thing is about prevention and people not going into that spiral, like you describe it. You know, and actually you could say that's something that affects all of us outside of ADHD. But if you've got that hyper focus and you channel it into the wrong things, you're going to become potentially so much more affected and do far more dramatic damage to yourself, let alone to society, which, you know, we sort of talked about. So that's where I'm coming at, is like, how can you head that off? I think schools is crucial. How many of these neuropatterns are formed in a young age? But that might be something to, because we know this, but sitting with the person that can really elaborate, how important are those formative years? Because if you get that message across, which we're trying to do, what are the most impressionable ages where those patterns are forming, that you could then create behavior that lasts into adulthood?
I'm not at all an expert on psychiatry and in particular child psychiatry, but I am a dad with a roughly 4-year-old, and categorically, the earlier that, you know, a stitch in time saves 9, I think is the expression. Categorically, I mean, it is obvious to anyone who has children or is around children that the earlier you can prevent these disbalances from becoming entrenched and like becoming like really, you know, something that's very difficult to like remove later or like deal with later, the better you kind of like give yourself some space later in life. There are going to be challenges. Everyone's going to go through heartbreak. Everyone's going to go through anxiety. Everyone's going to go through, I mean, sadness, of course, you know, that's just life. But by getting the right behaviors in place and the right beliefs in place, like, you know, you would have been the top hunter 10,000 years ago, so don't worry about the multiple choice questions, it'll be okay. gives you some space, I think, later, both to deal yourself and also to give the, for example, medication, other interventions a better chance of working, because you have a better balance. Ultimately, it's just about balance, right? Like that's what homeostasis is. Homeo, man, stasis, same. That's what your body's doing, homeostasis. So I think you just give yourself a lot of space later in life to deal with whatever challenges come along.
Yeah. And put practices into place at a young age, coping mechanisms.
Habits.
Yes.
Habits. And we've talked previously about if there's a bad habit, removing that box leaves a void. And unless we materially fill that void with a good habit, we're not sure what's going to fill that space, are we? And it will probably be another bad habit unless we've actually got on top of something. So there's part of a psychoeducational piece here of don't just try to stop doing something. Try to start doing something that is going to have a better effect. Yeah. Linking it all the way back to inflammation and the whole brain, gut and that relationship. If you're eating bad food, don't just try and stop eating bad food. Try to eat better food. See what impression that has up here, and then that will fuel you to want to do it more. We all want our chocolate. We all want our. I'm diabetic, so I want chocolate, but I can't have it. But it is. There's so much in here, isn't there? About we're in psychiatry, we're in medicine, we're in gut health, we're in physiological health, we're in blood health, and yet we're still talking about behaviours. We're still talking about those common garden things that we can get to grips with from about the age of 6 and really make a difference.
We live in a society, though, don't we, where talk about chocolate, you go into the shop and they line all the confectionery and the chocolate up as you get to the checkout. I'm guilty of it. Social media, it's temptation to go away from how we really know we should behave. I stay up too late. You know, I'm guilty of it, and I don't feel great the next day. And I'm like, and then so tonight I'll go to bed earlier. People have got that relationship with alcohol. I won't drink today. I'll just have one. So it comes back to discipline, right? It comes back to, you know, and I think with ADHD, it's probably that whole, like, how do you control that? And if you bring that messaging in early and demonstrate that's going to be healthy for you, it's going to make you have a better life.
Yeah, if you tell
message, right?
If you tell somebody with ADHD it's all about discipline, they're going to look at you and think, well, what planet have you come from? Because I am finding it very difficult to regulate what I need to be doing. So we've got to help that discipline, haven't we? We've got to coach, maintain some form of presence to actually build the understanding. You can't you go back to the caveman hunter-gatherer, or you talk to somebody sitting 20 multiple choice exams. You can't sit to a person with ADHD and say, try harder, concentrate more, and expect a better result. That's not going to happen. So what we've got to do is we've got to actually look at, is sitting a multiple choice exam the best way of doing something? We don't do this enough. One of the people we're interviewing later on today, if you said to him, here's a multiple choice exam on World Rugby, he'd fail it. If you said to him, now let's have a conversation about World Rugby, he'd tell you who played what position, at what time, in what game, what the score was, what colour shirts, he'd tell you everything. Yeah. Because it's all in there, but we're asking for performance in completely the wrong way. And that, so if we're asking for performance in the wrong way, linking it all the way back if I can, if we're demanding, not asking, if we're demanding performance in the wrong way for a large swathe of society, they're going to feel bad that they can't perform. Their mental well-being is going to start to be detracted. And this is from early age, isn't it? We put these pressures on people. Therefore, they're going to turn into having bad gut health. Their immune system's not going to be where it needs to be. They're not going to protect themselves. The relatable of the session between the couple's relationship between the two things going on takes a battering. And there's no way to pull out of that, because next week you're going to have another multiple choice exam. Yeah. And the week after you're going to, I call it situationally pissed off. It's not depression. You just can't see an end to this.
You also don't fully fit in. So that isn't working for that person. So, but there's no other option. So they're being forced to do that, and actually that's probably, you know, a key reason why so many people either feel isolated, left out, or in some cases don't conform enough to the point where they're committing crimes and getting into trouble for it when they don't actually know why or what they're doing.
Or starting to have really invasive thoughts about taking their own life, or actually taking their own life because they don't fit and we're expecting them to fit into something they're never going to fit into. You're 13 years less in lifespan if your ADHD is not treated. 13 years you'll live less is the average through diet, ill health, all those things.
That shows there's a direct correlation between
most
mental and physical.
Most of that's very interesting that you mentioned that. That is a true thing. Most of that can be attributed to inflammation.
Yes, and you come and
ultimately.
The first time that was introduced into my world was a psychiatrist saying, if people with ADHD live 13 years less, it's not because they're impulsive or hyperactive, it's because of their heart disease and fatty liver and alcohol consumption, those kind of things. And that brings it all the way back to what you talk about, that inflammation and the couples therapy requirement to get everything back in kilter to homeostasis. And I don't think people look at something as straightforward as ADHD in this construct at all. And I think we look at it, why can't you sit that multiple choice exam, instead of what's going on upstairs and downstairs here in the human body, and how can we give those 13 years back? So we talk about removing the shame and changing the optics on all of this. Maybe there's another message, how can we give someone 13 years back?
That's a brilliant message.
The physiological side of life, not just being able to sit a multi-choice exam. So if medical treatment has a purpose, it's not to get a child through the multiple choice exam, it's to give them, at the age of 70, it's to give them their 13 years back, isn't it?
Yeah.
And if we can start that at the age of 8,
and
we're
living healthier all the way through as well,
absolutely.
Right? Absolutely. That's not the best way of living, fighting that, to then have 13
absolutely.
years.
Don't battle it.
No.
Correct it now. You know, if you hit a golf ball and it's 1 degree off when you hit it, it's going to be considerably away from where you want it when it lands. Yeah. But if you can hit it true from the moment you hit it, it's going to be roughly where you want it to be. And I think life for a person with ADHD, the closer we can get to a sweet spot on the tee, the better we're going to be.
You summed that up brilliantly.
What a powerful conversation.
Honestly, I've loved that. I know we were both really looking forward to it. And Dan, thank you so much for making time to come and talk with us.
No,
we've run out of time.
Thanks for teaching me.
Wow.
Yeah, thank you. Really appreciate it.
Cheers, mate.
Pleasure.
Thank you.
There's just a misunderstanding that there is a deficit of attention, where actually, if you look at it for what it is, it's that we have interest-led brains. And, you know, at that time, maybe in a maths class, that's not of interest to me.